Hello, everybody. I'm Zachary Pohl, Ecosystem Principal at VSP Vision's Global Innovation Center. Today, healthcare practices are often organized as a series of separate rooms and functions, each optimized in isolation. The practice of the future, however, reflects a broader evolution of the industry and one that elevates the role of the practice and expands the range of care and services that can be delivered within its walls. Rather than simply rethinking the space, the practice of the future leverages AI and emerging technologies to unlock new efficiencies, enabling providers to see more patients while delivering more exceptional, highly personalized experiences across the patient journey. Insights from the VSP Global Innovation Center's Patient of the Future Report underscore why this evolution matters. Patients are seeking more connected, whole body health experiences and will prioritize providers and practices that meet those rising expectations. The VSP Vision Global Innovation Center Futurist Report on the practice of the future is set to become published next week. We run the Lens into the Future event series with our partner, Matter. Matter is a global healthcare innovation hub headquartered in Chicago that brings together entrepreneurs, health system payers, life science companies, investors, and other industry leaders to accelerate the commercialization of healthcare innovation. Through its ecosystem, Matter helps organizations discover, validate, and scale innovative solutions that drive meaningful business and patient outcomes. And at VSP Vision, our purpose is to empower human potential through sight. As the first national not-for-profit vision benefits company, this is what drives everything that we do. For 70 years, VSP has been a leader in health-focused vision care. Every day, the people that power our complementary businesses across vision benefits, eye care services, eyewear solutions, and practice solutions work together to create a world where everyone can bring their best vision to life. And with that, I'm so excited to be able to have such amazing panelists and people who are building the practice of the future so that you can hear from them directly how they are building the practice of the future and what their goals to be able to make it look like is. And then also what we'll need from the innovation community in order to be able to get there, to be able to improve patient outcomes. For you, I wanted to be able to start broad. And so for that, I'm going to bring in Callie Arduini ID, Director of Ventures and Innovation at Northwestern Medicine. Callie, how are you?
Doing great. That's something. How are you?
Doing well. Thank you. Let's get right into it, Callie. The one thing that we discussed during our prep is we've talked about the future of the independent practice, but I want to talk about health systems. From your perspective, what does the practice of the future look like inside a large academic health system? And where are you already seeing that future take shape?
Yeah, great question. I mean, these days it's certainly a moving target. 5 years ago, very few of us could have even imagined that ambient scribes would be listening and documenting visits every day now. But that's the reality that we live in now. We have thousands of clinicians across the organization who are using that tool and patients who are saying that it's really made their interactions with our clinicians so much better. And so I think ultimately we want the vision for kind of where it's headed the future to be more connected, more personalized, and a lot less complicated than healthcare feels today. I think that's the goal, that's the dream. I mean, for most of our patients, if you ask them what do they want when they're seeking healthcare, very seldom is their first response, I wish they had more technology. It's often much more real to them, which is, I wish they really understood my story. I wish I didn't have to repeat my history 5 times, depending on where I'm being seen. I
Thanks.
mean, the exciting part of where technology is today is that it's helping to solve some of that. We're seeing, ambient documentation help with that engagement in the room. We're seeing AI like chart summarization and message triaging help take some of that administrative burden off. And even AI voice outreach helping our patients get the proactive care they need. So I think we really are focused on and what we envision the future looking like is being able to continue to chip away at that complexity that healthcare has accumulated over many, many decades and leverage the tools that are out there today, the digital tools, the AI tools, all of it to be, focused on removing the friction between our patients, clinicians, and the provider experience, and less worried about AR robots taking over and more about those robots helping to kind of break through some of that complexity and help improve the experience that our patients have every day.
That's great. Let's let's go deeper into the ambient scribes there because our audience is a lot of people who are either founders, co-founders at healthcare startups, or they're looking to start a healthcare startup. Being able to work and get a partnership with Northwestern Medicine is so valuable and it's something that they want so much. And Ambient Scribes is such a great learning example for these companies because there's a lot of ambient scribe companies. And at the end of the day, you have to choose maybe one, two, three to be able to work with. What were the considerations that you took into account that ultimately led you to be able to choose which one was the best one for Northwestern Medicine?
Yeah, for us, and Ambient was a great example because we've made a recent change in who our partner has been. And
Oh,
so
interesting.
yeah, what we found is that the best companies don't just bring the technology. Everybody has access to foundation models now. I mean, saying today that somebody has an AI solution is a little bit like saying I have an electricity solution or an internet solution. Like we all have access to it. And so really what we find the best companies and the ones that, get our physicians' attention, get our nurses' attention, get our administrators' attention are the ones who understand how people's work has to change with that technology. So it isn't just about the tech, it's about the people because healthcare is inherently a people business. And so the way we think about it is really you've got to figure out how you're better than the old process, how people are really going to adopt it. Like the companies that scale successfully here are the ones who are ruthlessly obsessed with a problem and they know how to measure the value and the impact of their technology. At the end of the day, and naturally, again, I'm going to use AI as an example because it's so often, but Ambient was a great example. You know, the value and being able to say what does this do for our clinicians was the story we needed to tell. It wasn't just, hey, we're going to give you yet another technology tool. It's actually going to save time. We're going to be able to measure how much time it's saving you, and it's going to be able to give you back that time and that excess capacity to do with as you need to. And so for some of our clinicians that was okay, great, I don't want to work at night anymore. For many of our clinicians though, they see that their patients are waiting a long time to come and see them. They know that we're on, few months wait times in some of our specialties. So many of our clinicians gave that time back to their patients and were able to be more available to them. And so, the benefit of it was like the value was especially important and the promise of AI being that it can save time, then we had to show what we were doing with that time. And fortunately for us, our physicians not only had every story about how they were able to have dinner with their families and not be up late in bed documenting, but then they could also say they heard from their patients that they waited less time to come and see them, and they were able to get their questions answered faster. And really, again, the vendor that we ultimately went with and shifted to just over the last couple months was the one that really helped our clinicians make that change and adopt the tools and not just giving them the ambient technology, but really help them figure out how to adjust their day-to-day schedules and how to make the biggest impact on their patients.
That's very insightful. Thank you, Callie. Let's go on to thinking about 2031. What are your priorities to be able to achieve what you're trying to do from both a patient and doctor perspective? And what are the technologies that are required to be able to enable that?
Absolutely. I mean, first and foremost is just keeping up with technology. I mean, the pace of change is incredible right now. Um, 5 years ago, all we were talking about was telehealth and digital coming out of the pandemic. Today, everything is AI and AI agents. Like 5 years from now, we'll probably have a new term that we have to say 100 times a day and pretend like we've always known what it meant. And
Yeah.
so I think for us, it's building the capability to continuously learn and adapt and to empower our workforce to be at the forefront of that so that we can also help our communities and our patients understand what all of this new technology means for them and how it can be useful. We have a long-term strategic vision. We actually call it NM 2035. So a little bit past that
Oh,
2031 date.
that's great. That's great. Use that.
Yeah,
Yeah.
right. It aligns with this very
Yeah.
well. And one of the pillars of that is to create an only at Northwestern medicine experience. So we don't want our patients just to compare us to any other health system. We want to be compared to the organizations and even the commercial vendors out there that we all know, the Amazons, the Ubers, the Chat GPT, that make life easier and make it easy to use those offerings and those solutions and tools. We want to be, we want the bar to be up there. Like, where do you get the delightful experiences in your day-to-day lives? We want healthcare to ultimately get there as well. But I think the bigger thing that we're starting to think about now with many of our clinicians is we've got to be prepared for the patient that walks into our appointment with a lot more information because they've already asked ChatGPT all the questions about their care. I know I do it. I know my family does it. And so it's not, hard, it's not hard to believe that our patients are showing up in that same way. And now granted, search engines, Google, it's allowed patients to get a lot more information for many, many years. So this is not all that different, but these LLMs give that information to them in a way that they understand, whether it's correct or not. And so, it can be really empowering, but there's risk there as well. And so we're working a lot with our physician leaders to work through, like, how do we help patients become informed users of that tool in addition to the information they get from us, without assuming everything they read is 100% accurate, and how can we help patients navigate that and translate all that they're finding out there into what they can practically take, drive and forward with their health day to day.
That makes a lot of sense. And the empowered patient who now can come in and prep themselves, understand their history. That's both so exciting for just medicine and the patient and the healthcare system, but then, like you mentioned, also scary because LLMs can say they have their own biases. They can say things that are dangerous, and that is just the perfect segue. I could have teed up a better segue for our next speaker, and right at time. So, Callie, thank you so much for being able to join us. This was so insightful. Thank you so much.
Very, very welcome. Glad to be here.
Bye, Callie. And next up, we are going to be hearing from Dr. Slotkin, the CMO of Geisinger, neurosurgeon and general partner at Scrub Capital. John, how are you?
Hey, Zach, how are you? Thanks for having me.
Of course, always so great to see you.
Yeah.
Let's get right into it. But I do also want to stay in the year 2031, because of the breadth of what you're able to see from the different hats that you wear. Which healthcare technology categories have become mainstream in the provider's office, and which, while can be valuable, still are not widely adopted?
Yeah. And first of all, let me say thanks for having me to you and VSP and the whole ecosystem. Really enjoying being here and the other panelists as well. For that one, first thing I'd like to say is this crowd is leading in these areas. You all probably know, but I learned in researching for today that in 2018, the very first autonomous AI diagnostic ever FDA approved was to look for diabetic retinopathy without a clinician reading the image. So this room is ahead and living in the future, compared to most of us. Um, Here's what I think I'm seeing today, and we're seeing that's going to become table stakes well before 2031, but will be kind of the what we're putting in place now and in the next 18 to 36 months. So, and the question was in a doctor's office. There's so many other areas we could talk about, whether it's revenue cycle, patient facing, et
Yeah,
cetera, but doctor's office. So what we're
yeah,
going to
yeah,
see, I think, is LLM in the EHR that's already coming live in places. And as it stands today, separately, Another software suite that sits next to it is next best action. What is the next best action for the patient sitting in front of me? What is the next best action for a population of patients? Then, sort of sitting next to that is knowledge management. So that would be like Doximity Ask or Open Evidence. And, that's sort of what does the literature say I should do? Then another piece is what would another organization seeing the same patient do? And for us, that's Epic Cosmos. And there's other things like it, right? So now, where does that go? Well, and of course, ambience there too. By 2031, those aren't separate pieces that you have to put in separately, and you probably don't even feel them as distinct or something special by 2031. That's just going to be how we operate. And I think back, I'm old enough, and some of you are to remember 20 years ago, where hospitals had, and I'm not joking, like a department of the internet and a department of email because we were convinced we would lose all of our PHI to this new technology. There were committees stood up and work groups, and everybody was going bananas, just like they are about AI now. But now that's um, table stakes. It's the electric grid under our feet, and that the technology I just named, that's going to be similar then. And so when we talk about like that stack, then of course there's going to be a whole stack the patient has and others are working on, some of which we give them, some of which they bring themselves into that same equation. And then to your last piece, like what's going to still be valuable but not widely adopted? I think sadly there's a lot of answers we could give here, but the one that's been top of mind because I'm working on it right now recently a lot is um, genome informed prescribing and
Mm,
treatments. So that,
mm,
as we all know, that tech's available now and it's used in pockets, right? Like, oh, what depression med's great for this person over here, and what psych med,
yeah,
what psychotic med. But you don't see that at the scale I think it should be yet. I think it's earned that it be. And it's because the bottleneck there is not the tech. The bottleneck is like who's willing to pay for it and also who owns that workflow. Is it primary care? Is it psych? Is it the insurance plan? Right? Like no one's quite sure. Now there's companies like Helix, which I'm not invested in, no, but I'm a fan of, that are working in this area to solve this, really with genomics at the point of care and thinking about it as a CLIA certified approach instead of just like this is this cool research that we do. So I think that's the piece that probably will still need more instantiating then, which is pharmacogenomics being really kind of like live.
that makes a lot of sense. And that brings me to my next question, which is what does the OR look like in 2031? Does it look different? And if so, how does it look different?
Yeah, it's a good question. So I've spent a lot of time recently thinking about embodied autonomous systems. And when I think about the OR right now,
Mm,
we have autonomous systems and we have robotics, but we're not quite to the marriage yet where we have embodied autonomous systems. And I think that's what we start to see increasingly over the next 3 to 5 years. Can you still hear me okay? I froze up a little bit there. Am I okay?
yeah, you're good.
Okay, good. Um, so like what autonomy is live now in healthcare systems? Well, sepsis prediction, a lot of imaging triage, retinal work, a lot of other things in optical. But most of those have no body. And then the things that have bodies, like the Da Vinci robot, don't have a soul yet. And we're going to see those coming together. Some people probably saw last July a Hopkins group, Axel Krieger's lab. They published in Science Robotics a robot performing autonomously an entire slice, not the whole thing, of a gallbladder resection, where they clipped and cut the duct and artery. But the thing is, that's not actually the hard part of the surgery. The hard part is the dissection, the redo, the adhesions, the bleeding. And this was ex vivo, porcine ex vivo. But look, we still know that tells us where this is going. Um, and what we're going to increasingly see there is the autonomy getting more and more comfortable with more and more variations. And so I think the next 2 to 6 years brings the autonomy starts to come into the procedural rooms first in the periphery and in the supporting structures. So like we've all probably seen pitches from, hey, we can track your surgical tools. We know what the person wants. We're going to tell you how your inventory is or how you teach new surgeons. So it's going to kind of start there and work its way more and more to the center of the procedure room. Um, and one thing I'm stuck with, and I've been writing about a bunch lately in autonomous vehicles, is that, and probably appropriately so, but we still need to deal with this reality. We're going to hold the first autonomous surgical step to a standard that no human has ever been held to in history. And that's because this gets to be a trust thing, not a capability thing. And if you want to go deeper on that, kind of trust as the driver of real adoption here, I wrote about that like 3 weeks ago in the magazine Noema, which if you're not subscribing to, I think you'll love. It's tremendous and free, where I'm absolutely have to be the least smart writer in the last 12 months there when you look at who writes for their Blaise Aguirre Arcos
Wow.
and Nobel laureates. So check it out if you're interested.
Wow. Yeah. Yeah. I've loved so much your advocacy for the ability to be able to save lives with autonomous vehicles. That's actually I just for the audience. I was like in bed reading a news article and John was mentioned, and I like from bed emailed John like John exclamation point, you're in this article. But that's such a good point that I hadn't thought of, which is it's not just going to have to be able to match what a human safety level is going to, but exceed that so much greater. It makes so much sense, and yet I'd never thought about that.
Yeah.
Moving on, yeah, Scrub Capital is built on and I'm just looking at my questions. That's why I'm looking off camera. Scrub Capital is built on the idea that clinicians have advantages in identifying and selecting the value a startup's technology can provide. As you evaluate emerging technologies, what signals tell you a company is solving a meaningful clinical problem?
Yeah, thanks. We and others like us look for, I think, a lot of the same things, and some of them are core. So the first, I think, always needs to be, is this approach solving a real lived problem that we either have or we're going to have? Because too much out there right now is innovation theater or like innovation for innovation's sake. And this idea that you're solving something people are actually facing, is critical. Um, and along those lines, and that sort of tech and innovation theater avoidance is, are they realizing that, and are they going to be a part of this idea that tech is one way to achieve a strategic aim? It can't be a strategic aim. Like, oh, let's do the AI thing versus like, here's our mission over here. And certainly AI is not in your mission statement if you're a healthcare provider. Now, it might be if you're an AI company, but if you're a healthcare system, it's not actually named in your mission statement or your vision statement or your action plan for the year. So, how does the tech that's being proposed solve one of those problems? Like, that's what we want to look for. Then, looking at these companies, we want to hear, do they speak the language of healthcare because they've lived it and felt it? Not because maybe just they wrote about it or, you know, consulted a little bit on it. And that's not to say there haven't been very successful consultants and writers, and there have been. And we don't only back clinician founders, but we see that they do well. And Hallie Tecco and others are increasingly publishing that having a clinician as a key part of the founding team or a founder or the founder is a predictor for success, financially.
Mm,
And then I think two more. One is, are they in this for the right reasons? I think increasingly, and it's not a new problem, but it's getting a little worse right now. We're seeing what I've and others have called like the suitcase farmers. That was from the Dust Bowl, where like they were going to come in, plant crops, and leave, and then just come back and get the money. Those folks almost are never always going to not do well. Um, for me personally, this is just my own opinion. When I think about open evidence versus doximity, open evidence to me feels a lot like suitcase farmers. And I say that because in lawsuit that you can find online, their CEO will say things in emails to people allegedly, and this is all alleged, but it's in the documents like, we're going to pay you X million a year if you come work here. We'll sell this company. We're going to make a ton of money. That feels like a
Mm,
suitcase farmer approach to me rather than like,
mm,
we've been in this for decades and we're in it for the right reasons. And last is, does the team actually know how money moves in US healthcare now and
yeah.
how it's going to
Yep.
move? I think
Yeah.
that's one of the most common reasons companies fail is they're set up for a fantasy version of the way US healthcare will move money or an old version, but not the current version or the way it's going to happen, or at least they can't speak well to how money moves. If you don't know that, sadly, it's unlikely you're going to succeed.
I'm really glad that you said that last part. We look across the globe for innovations to be able to elevate the eye care experience. And this is true in so many parts of healthcare, maybe especially in medical devices, because they tend to launch first in Europe. But being able to understand when they've worked in different countries first, and then when they come to America, being able to understand the financial system and how money moves in America is such a large lift for them, understandably so. That's very complex. I want to ask you one more question, John, which is when you're doing these as part of the due diligence for the companies that are maybe in the middle of having due diligence done on them with Scrub, you have these meetings where you have actually your LPs and friends of Scrub Capital who are physicians who sit on those calls. Um, and then it's set up so that in the last 20 minutes, just the people who are on the call, but not the founder, get to be able to discuss what they think and things like that. What have you learned from those sessions, since you've done so many of them now, about what the providers are looking for and what their needs are and what they'd love to be able to see but still aren't seeing?
Yeah, good question. So, yeah, that's part of our model and some of the real alpha we're seeing in Scrub. And I think, gosh, what are we, 16, 17 investments in Fund One. We already have like six markups. So it's going well. This is only a year and a half, 2 years in. We think that this is the superhero power, is this community that sits with us called Scrub Collaborative. And look, you
Mhm.
don't have to be a clinician to be an investor. And Fund One is closed, but we would anticipate a Fund Two, not super far away. But by number, a lot of our investors are clinicians, and these are not just any clinician. These are leaders in their fields, in their areas, in their regions that bring these great perspectives. And what I'm seeing that's probably the biggest strength they bring to these calls is, does the thing proposed seem like something that will work in my lived reality, not in an imagined reality that maybe an investor that's never walked into a hospital as a leader might imagine, but healthcare as it's really exists today, or as I envision it'll exist in 5 years. I think that gets to be the biggest differentiator. And as to what I think they look for in the founders on the calls, it's a real sense of what challenges we, our patients, our members, families are facing. That if there's a real understanding of that, you're most likely to solve real problems. And it's not that everyone has to come fully baked. We do pre-seed as well. But then at least there's some evidence that that's the appetite. Even if I don't have that today and I'm looking to get people like Zach and others to help me, there's an appetite to get there. Those seem to be the biggest differentiators.
Makes a lot of sense. John, we could keep going, but we are out of time and we have the next speaker. So always great seeing you.
Thanks for having me and a terrific event. And folks out there, if you want to reach out to me, just hit me up on LinkedIn and I'll try to answer. Thanks so much.
Fantastic. Thank you. And next up, I really wanted to be able to provide for the audience. a company that is doing extremely well on that opposite side, creating the patient side of how they interact with the practice of the future, who does show all of those traits that John just spoke about. And what Callie had mentioned at the end of our talk when we talked about how patients are coming in proactively with information that they accumulated by prepping through an LLM. And so, with that, I'm going to bring in Dr. Arpan Parikh, a board certified psychiatrist, as well as the co founder and CEO of Kin Health. Arpan, great to see you.
Hey, Zachary, thanks for having me. Thanks for hosting this event.
Of course. Let's get right into it. The subcategory of this is extending care beyond the four walls. And one of the report's biggest themes, when you are able to read it, is that care shouldn't end when the patient leaves the practice, or nor should it begin when the patient comes into the practice most of the time. KIN was built around supporting patients between visits. What convinced you that this is where healthcare has one of its greatest opportunities?
Yeah, it's a great question. I mean, ultimately for me, it was two lenses that converged. Lens number one was my experience as a practicing physician, and I still see patients to this day. And I'm a psychiatrist. I see my patients for a little longer than the average healthcare professional might, 60 minutes. But that's 60 minutes in a week. And there are 6 days and 23 hours of the week that that patient isn't with me, and a lot happens in their
Yep.
life and in their healthcare journeys during those 6 days and 23 hours. That perspective then converged with a personal caregiving journey that I went on with my wife when my mother-in-law was diagnosed with breast cancer about 3.5 years ago. And the family came around her to, become the quarterbacks of her diagnosis and treatment journey. And what I and we quickly realized is, even though we had every structural advantage you could want in a situation like this, right? Resources, access, knowing every cheat code in the book as a doctor, it was still really challenging to navigate to a successful outcome. And what made it the most challenging was the inability to seamlessly and quickly ingest and share information, right? For folks who are scattered across the country, busy with their own lives, but trying to be helpful and trying to advocate. So it was both my experiences as someone who sees patients and was taking care of a family member that really drove home the point for me that there's been an incredible amount of innovation that's happened on the system and the care delivery side, which previous speakers spoke to. I'll submit a maybe somewhat heretical point of view that we've left behind the most important stakeholder in the healthcare system, who's the patient. And that's a perspective we're taking with Kin.
I was attending health a couple years ago, and it was the former CEO of one of the largest hospital groups in the country. And he had this amazing quote, which is, our hospital or our healthcare system is set up to do an amazing job at helping the customer. The problem is the customer is rarely the patient.
Right.
And I love that. Yeah. And you said something that I really want to dive into because, and by the way, if you'd like to download the Kin Health application for yourself, we are going to put, great timing, a link in there. I personally used it for my dentist's appointment last month, and it was helpful. It was great. I had more harder than I thought I was going to, unfortunately. But one thing that you mentioned was being able to bring in other people into care. And when I opened Kin and I saw that you really built out that functionality, that really got me excited. That's one of my favorite parts. Is it's so important because it's not just so important for me, but it's so important for the sandwich generation. What are the indicators that tell you this is going to be a larger part of care in the future?
Yeah, it's a great question. It's one of our core hypotheses and perspectives at Kin. There's actually a great paper or piece that was written by care.com that they released a couple of weeks ago. And they specifically, looked at this sandwich generation. And I mean, the numbers were staggering and incredible. I would encourage everyone to take a look at it. And I'm sure a lot of folks on this call are living this and experiencing this in real life, right? Um, some of the things that stood out that, tell me like this is a leading indicator for we need tools and solutions to support this cohort of Americans. Number one was the average person who now is a sandwich caretaker. They're taking care of their kids and also now taking care of aging parents. Um, happened around age 34. So you have Americans now in their mid 30s, right? Just getting into the meat of their own professional careers, personal lives, starting their families, and now they're thrown into also taking care of aging and potentially, sick parents. And the more staggering number was for those folks who have been thrown into dual caregiving situations. They're spending 24 hours a week managing care for their children and their parents. And 24 hours a week is no joke, right? That's a part-time job on top of a full-time job, on top of raising a family. So I think our population demographics in this country mean this is going to be happening only more and more frequently. And again, I'll double down on the statement I made earlier, which is no one's built tools and like beautiful tools, right, to help support the family in this situation. We talk a lot about, and listen, I'm a psychiatrist myself, like we talk a lot about resilience and caregiver burnout, and we should all be better at this, but I think that's actually the wrong story. The right story is that we need to arm caregivers with more tools, so that they can do a better job and be more efficient, while also not spending 24 hours a week trying to chase notes in 3 instances of Epic with 3 different logins, which was literally what our family had to do 3 years ago.
Yeah, and that's just 3 years ago.
Yeah.
Right. Yeah. Small thing, because that's actually a good point, which is you might think and I've thought this, if somebody's in the middle of that sandwich and they're taking care of somebody, they're not taking care of one person, they're taking care of five,
Yep.
6 people, right? Have you seen anything as consumers and patients are using the app that's surprised you in terms of like what their needs are and desires were that wasn't part of your original hypothesis?
Yeah, it's a great question. I would say most of the usage trends are lining up with what we expected would be, the stickiest and most engaging use cases for Kin. So there's sort of like two phenotypes of users or patients who are using Kin and engaging with Kin the most. The phenotype number one is folks who are sandwich caretakers, and we see them using Kin not only for their children and their aging parents, but also for themselves. So they're really power users using it for like 3 different cohorts. To your point, it's like 4, 5, 6 people. And then there's a second cohort of caregivers, which I think also goes a little bit unnoticed and unspoken about, which is we're seeing a lot of folks who are in their 50s to 70s, or even 60s to 80s, who are using Kin not necessarily for their own healthcare, but for a spouse's healthcare. So they may be relatively healthy themselves, but they have a spouse who has a chronic or multiple chronic conditions. And they're using Kin to try to help themselves navigate and manage that care. So those are two pieces that sort of line up with our original hypothesis, and we're sort of doubling down on from a product perspective. In terms of maybe something we're seeing that's slightly unexpected, we are seeing folks use Kin, and this actually goes to what you mentioned earlier, not necessarily just in traditional healthcare settings, but in sort of non-traditional healthcare settings and even some paraclinical settings as well. And I think this also speaks to like what is the practice of the future, right? Americans don't only engage with their health and wellness in a doctor's office. Like that's one of many places that Americans in 2026 engage with their health and wellness. And the establishment or enterprise tools that store, collect, gather, and manage healthcare data, they don't play outside of the traditional healthcare system or ecosystem, and they don't have line of sight into all the other things that happen in Americans' healthcare outside of the brick walls of a doctor's office or a health system. So that's a huge gap. I think the traditional system faces, and it's something we're seeing our users actually lean into heavily.
That makes a lot of sense. The report explores remote monitoring, at-home testing, and ongoing digital engagement as ways to extend care beyond the clinic. What does a truly continuous care relationship look like, and what should providers start doing between visits that they're not doing today?
Yeah, great question. I'll answer this question from my lens as patient-facing doc right now, which is the reality is most Americans, most of my patients also see other healthcare professionals, and they also engage with their health and wellness in other places outside of my office. So one thing I think all healthcare professionals should be doing, and we should think about the tools and services and platforms that enable this, is we need to have that full picture, right, of understanding what is happening in my patient's healthcare when they're not in my office. And there, again, if you think about a patient who, let's say, comes to see me in my outpatient psychiatry office, and then sees an acupuncturist once a week, and then has a physical therapist they see once a week. Like, what happens with their acupuncturist and physical therapist? Like, none of that data is in an EHR. That data doesn't go into an HIE. That data never really even probably makes it to a claim that drops from a health plan. But that data is super important for me as their treating psychiatrist who's managing their depression from chronic low back pain to know. So I believe every healthcare professional in this country should be thinking more about what are all the ways my patient is engaging with their health and wellness. And I ought to understand what's happening outside the office. Because if I don't understand what's happening outside my office with my patient, then I'm probably not going to be in great position to actually help them with what they're coming to me to get help with.
That makes sense. Makes sense. That's great. Arpan, we are unfortunately out of time. Thank you so much. This was so insightful. And I will be seeing you soon, I'm sure.
Yes, thanks. Thanks for having me,
Yeah,
and thanks for pulling this together. Appreciate it.
of course. Bye, Arpan.
Bye.
And then last, what I wanted to be able to do is provide everybody who's attending with the opportunity to be able to see a really specific example of so that you can make this more concrete and really be able to understand it. And one thing that we do in these futurist reports and into this into the future event series is we bring in all of healthcare. And then we also include optometry in there to really be able to highlight how optometry and focusing on your eye health is part of focusing on your entire health. And so with that, I am now going to call in our last speaker, Dr. Justin Manning, an optometrist, as well as the Chief Member Experience Officer of PECA. Justin, great to see you.
Zach, thanks so much for having me.
Of course. I also like seeing the podcast setup. This is great. I've never seen this one before. Let's get into it. When you picture the practice of the future, what's the biggest difference patients will notice from the moment they walk into an optometry practice until they leave?
It's a great question. Thinking from my perspective, seeing the practice of the future, I think the patient's going to experience a more connected, experience from, as we look at the patient journey in the eye care space. There's components of the exam that are going to be done before they even step foot within the practice. Technology is going to play a role in elevating their experience as they come in from a pretest standpoint, in how they engage with the doctor in the exam room, and then how they engage with the retail component in eye care specifically as they purchase glasses or contact lenses after their exam. I think it's interesting because we as human beings, we crave connection, and we want the stats show that patients want their doctors to use AI, but they don't want AI to be their doctor because they want that trust, they want that human interaction, and they want that connection. Yet we're busier than ever. So we don't want to, as we think about spending our time going to a healthcare, going to a visit, an eye exam, for example, sitting in the waiting room, we want to make sure that our time is well spent. And I think the practice of the future is going to capitalize and improve the experience overall. leveraging the technology, leveraging AI, not just in outside the four walls, but within the four walls of the practice as well.
I'm glad that you brought that up, because that comes up to another question that I wanted to ask. Side note, I know that Arpon has used the KinHealth app to be able to get ready for his optometry appointments and has used it in there. Uh, AI is becoming part of nearly every aspect of practice operations, from documentation and scheduling to patient communication and workflow automation. Through your work with independent practices, working with so many of them through PECA, where are you seeing the greatest value today, and what separates practices that are successfully adopting AI from those still struggling? Let's start with the first, and then we'll get to the second.
Sure thing. So PECA as an alliance organization supports more than 8,000 doctors across the US, and they're all in private practice.
Yep.
So they have their own business that they're running, that they're delivering care in, and they're wearing both hats. The doctor owner is wearing the hat of CEO and managing the business while also delivering care full time. So what is interesting about AI and its use in our world within private practice is it is a broad spectrum as who is using what and how. I really see it as two pathways: the administrative side, the business management side, and the clinical side. And the reality is the greatest impact right now is on the administrative and business management side of running the practice, running the business itself. I mean, we see doctors using it in marketing, from creating social media posts to developing their marketing strategies. And we know back to school season is upon us right now, and so they're leveraging it to help them build out their campaigns to reach parents, families that it's time to get their kids in for their exam before they go back to school or right as they are going back to school. We see doctors using it responding to Google reviews. How can I, both on the positive side or the perhaps less than ideal experience, how do I position a response that is professional, truthful, transparent, and also doesn't reveal any protected health information? We see doctors using it and analyzing their financials, understanding where their practice opportunities are, staff meetings, having challenging conversations with their staff members and how to address challenges or problems, building training manuals. There's all sorts of different ways that practices are using it today that I think are the most impactful right now. The clinical will come, but the administrative side is really, I think, the biggest impact today.
And what separates practices that are successfully adopting AI from the ones that are struggling with it?
This is going to be an oversimplification from an answer standpoint, but it's docs that are willing to use it, and they're docs that are willing to try and make mistakes, refine when something doesn't quite go as well. They're not afraid of it. They know it's a tool that will help them, and they're engaging with it, and they're learning, and then they're applying those learnings to how they continue to engage with the technology.
You might have actually been there, but some of my colleagues, Will Flanagan and Chris Perry, were at a regional event. It was at the PEC event, actually.
Yep.
And they asked a survey, how many of you are using AI, and 1 to 10, how often are you using it? And this year's was so interesting because not only did we see about a third of them said they're using it constantly, which was maybe it was like 10% or 15% even 1 year prior. But we saw an almost inverse bell curve where you had about a third of people who were ones and twos using it all the time. Then you had about a third of people who took up like the entire middle. And then you had a third of people who were on the extreme other end of saying, I never use it. And that was so interesting to see that reverse bell curve. Or sorry, maybe a better way to put it is a dumbbell where it's very strong on the ends and very small in the middle. That was so interesting to see. I've rarely seen that before. The report also points to new opportunities beyond the traditional eye exam, including myopia management, dry eye, hearing care, aesthetics, and smart eyewear. Let's say today is August 6th, 2031. Which of these areas has accelerated the most over the last 5 years and why?
I love this question. For me, if I just look, there's a lot of great resources in great, say, call them subspecialties within eye care that are advancing. If I look at myopia management and dry eye, those are really standards of care today. Now, I recognize not every practice is fully engaged with that, and technology as it advances will make it easier for practices for doctors to provide those resources to patients or those solutions to patients and make it easier for patients to engage with them. But I really do believe that myopia management and dry eye as care opportunities really are today's standards of care. What excites me, if we fast forward to 2031, I think smart eyewear is going to play a big role. We know the history of how it started and fizzled very quickly, but there are now more players in the space. There's more options. There's more components that make them more fashionable and therefore more enticing for patients and consumers, I think, to wear. It's more subtle as opposed to some of the technologies that the early innovators in this space. I'm also really excited about the hearing side of eye care. Well, for one, we know we've got a few players in the space that are both smart eyewear and hearing care in one.
Yeah.
If we look at Australia, if we look at Europe, the biggest provider of hearing care in geographically in those areas, it's eye care, it's optometry, it's primary vision care is where the primary area where hearing care is delivered. It's not that way yet in the United States, but with, I think, this advent of smart eyewear that also is a hearing aid, and patients, back to that timepiece that I mentioned, they want to utilize their time in the most efficient way possible while also having that connected personal relationship from a care standpoint. So bringing hearing care into the eye care space, leveraging these tools, leveraging these new solutions, I think will really deliver a better outcome and a better experience for patients come 2031. And frankly, we haven't even talked about oculomics yet, but as a clinician myself, that is something that I think will also advance significantly, but that's going down the clinical side.
So listen, you're already answering the next question I was going to ask. I'm going to ask the question, and then I want you to start talking about what you were starting there with oculomics. The report recreates each part of the patient's journey in a practice. Which area do you think will experience the greatest transformation over the next 5 years? And what opportunities will that create for providers? Maybe oculomics there isn't your number one, but I'm sure it's part of your top three. So talk about oculomics in that with that perspective, in that context.
Absolutely. Zach, to your point, oculomics is definitely in the top three. I think my top one is pre-test and how we accelerate we move elements of the exam and the care outside the four walls to elevate and make the experience more efficient. But as an optometrist, we as providers have said all along, the eye is the window to the body. It's the only place in the human body where we can directly visualize blood vessels, nerve tissue without having to make an incision. The amount of systemic disease that can be diagnosed and managed through eye care and in conjunction with other specialty care providers is significant. So the role that oculomics, using the eye as the window to the body, leveraging what AI can do, which is things at scale that we as humans can't do, or in many ways, things that we as humans can't do at all. I'm really excited for how these technologies, which will use retinal scans, retinal images to predict chronic kidney disease risk, cardiovascular disease risk, Alzheimer's, and dementia risk, both diagnosis and progression, really, I believe, will transform the role that eye care plays in broader healthcare, but also the role and the view that the patient has of eye care in their broader healthcare experience and their long-term care journey.
What do you think? What will the patient see that really makes them light up when they're interacting with oculomics? Do you think it's the diabetic retinopathy? Do you think it's a bioage? Do you think it's something with cardiovascular or neurodegenerative disease? What's really gonna, when they see it in a report or something, really get them excited?
Frankly, I think in the short term, it's the wow factor. It's the why hasn't my provider ever done this before? Or wait, you can now tell me these things just through my eye exam or through this retinal image. So I think in the short term, it is the wow factor of insight that nobody had before the advent of these technologies. Fast forward 5, 10 years, I hope it's if I put my public health hat on, I think it's the role that these technologies play in connecting the patient deeper into their own healthcare journey. Earlier detection, better long-term outcomes from their care, and from a chronic disease standpoint,
Yeah.
the earlier the diagnosis, the earlier the intervention, the better the long-term outcomes, and the ability for these technologies to connect this information not just within the four walls of the eye care practice, but with all of the providers that support the long-term health care of that patient.
That makes a lot of sense. Justin, we are coming up on time. It was so great to be able to have this conversation with you. Thank you so much. And I'm in a meeting with you later today, so I'll be seeing you in a couple of hours.
Thanks, Zach. Appreciate the opportunity.
Of course. Thank you. And on behalf of VSP Vision's Global Innovation Center and Matter Healthcare, we want to thank you so much for being able to come here and spend time with us and learning. And we hope that this was valuable for you. If you'd like to follow up with VSP's Global Innovation Center, please reach out to us. We are available on LinkedIn, as well as you can find our contact information on our website. Whether you're an innovator who's looking to be able to work with us or any one of our programs, or you're interested in Matter, these are excellent opportunities for you to be able to make an impact. We hope that this was valuable for you, and thank you so much for joining, everybody.